Good morning, everyone. Um, Thanks for joining us again today. We have spent a lot of time focused solely on Congress's reconciliation bill, as was appropriate because that was what was moving. But that doesn't mean that there aren't a heck of a lot of other things going on in the federal government that impact people with disabilities. So today we're going to try and catch you up on what is happening now and give you a little preview of what we might expect in the next month, as well as give you some really solid questions, very specific things that you can ask your members of Congress, kind of after every section that we do. So we're going to talk about, Congress, and we're also going to go into some of the things that we're aware of that the President Trump's administration is doing related to disability. First, though, last week we had and this week we had Wisconsin reacting to the passage of the reconciliation bill. So, a few things to highlight for you. Our Wisconsin Medicaid agency this week put out a release that was pretty forthright about what they thought that bill would mean to Medicaid and to SNAP. So if you are in a position where somebody says, I don't think this is going to impact Wisconsin, the Wisconsin agency that manages Medicaid and SNAP disagrees. They think it is a big deal. And they not only put out a press release, but also kind of a white paper that goes through some of the things that they think are going to be most directly impacting individual people. I only put page one on here, but you can see the link at the bottom if you want to access it. Um, and some of the things that ended up highlighting by the department are things we've talked about a lot over the last several months, including prove you're working or exempt requirements, retroactive coverage, and changes to how SNAP is run that will impact how easy it is to get and stay in these programs and whether or not people will lose coverage or lose food assistance because they can't make it through the paperwork. Now, they didn't list all of the changes that we've talked about in the reconciliation bill because people like you and I, who are really, nerds on this stuff, we will be like, ooh, they changed the matching rate. And we know what that means, but the wider group of Wisconsin does not. So be prepared that when you look at this sheet, you won't see everything we've talked about. It doesn't mean it's not impactful. The other thing the department is starting to telegraph now, and you may remember when they did the unwinding after the pandemic, there was a period of time during the pandemic where everyone kept their coverage without being reevaluated because it was a pandemic. And then they had to kind of undo that, where they had to reevaluate everyone again in the last, I think, 18 months that's happened. And you might remember that the department had a pretty constant message of make sure we have your current contact information so that you can get the information directly from us. And they are starting to send that message again. So if you have people in your life or clients or folks that you're meeting with in disability world, know that the department is really wanting to make sure that everybody who's currently in the program, their address is updated. They aren't going to know exactly what it is they're going to have to do or when right now, but they know that if people don't get the information at the right time, it's going to increase the odds that somebody's going to miss something and be at risk of losing coverage. So that is a message that you can send to your folks. I also talked about the press conference the Wisconsin Medicaid Coalition had. And here is the article that came out of that. Maybe some of you have read it already. Really good article. And I think the thing that I learned from that is that there are many, many people who do not understand how difficult the process of applying for and renewing your Medicaid coverage is now, especially for people with disabilities and people who may be waiting on Social Security for a disability determinants. And I raise that for this group because you are an expert in this stuff as it is now. And I think the folks at the press conference did a great job of saying, these are the barriers and the things that are really hard for people right now. And you want to add more things for them to do that have a time limit and are confusing. So everything that's hard now will get harder unless we think through, how do we invest in the workers with expertise and the systems that are going to put us in the best position where we can move people through a process quickly so that they don't end up losing coverage or getting billed for things that that Medicaid won't cover because it happened too far in advance of when they got into the program. We also saw a number of providers this week. This is one article that I saw this week that are, following up on their press contacts and saying, hey, I am not convinced that this bill is not going to impact the people that we care about. And this is a particularly nice article. So if you have not gotten in contact with your local press yet and you're wondering, like, what's an example, this is a really good one. And I think it's really useful that the folks who work with people with disabilities and their families are noting that, hey, they're saying we won't be affected, but in the next breath, they don't know the details and showing that is those two things are not reconciled. And 2 days ago, Wisconsin Health News, which is a specialty publication, held a panel series. You may recognize some of these names, and to talk about, well, what does this reconciliation bill mean for Wisconsin? If you Wisconsin Eye is free to subscribe to. So if you haven't had a chance to see it, I would recommend people do that. It's about 45 minutes long, and you can see that there's a variety of different perspectives. So Leading Age is really the trade association for the nursing home and assisted living facilities, hospital association. We have a variety of perspectives here. And one thing that you may want to notice is how are they talking about Medicaid and what do they emphasize? And I'll ruin it for you to say there's only one person here who is an advocate for people who are using the program. All of the others are provider organizations or trade associations who are paid with Medicaid dollars. And I think it's really useful to hear this conversation because what I notice is that there's often a lot of discussion of budgets and rates and pay and money, and less discussion about what that means to people. So listen to this and then, kind of lean into your role as representing the folks who are actually going to be impacted health and long-term care-wise by decisions. These are money decisions in the sense that that's how things are paid for, but I think there's a real role and voice for people like yourself and advocates to make it real about what do those dollars that are being rearranged actually mean for people's lives. So Congress, what have you been doing? It's been a busy week. Here's kind of a condensed timeline, and you'll notice this is all in the next couple of months. And since I put it together, there have been some changes already. July 18th, Congress just passed the rescissions bill, I believe, late last night. So we can talk about that and what it means. They're in the middle of trying to create a federal budget for the federal fiscal year 2026, which expires September 30th of this year. There are some additional rescissions bills that may be coming, and talk of maybe wanting to do a second reconciliation bill. So lots going on. Let's talk about the rescissions bill first, which we have mentioned in other webinars. This is an unusual thing. Rescissions bills are when Congress reevaluates and decides not to spend money that it previously agreed to spend. They're pretty unusual. So the administration can ask Congress to do this. And once they have asked Congress to basically not spend money that Congress agreed to spend money on, Congress has 45 days to act. And importantly, just like a reconciliation bill, a rescissions bill only needs a simple majority to pass in the Senate. This particular rescissions bill does not have any spending cuts that directly relate to people with disabilities. But there are lots of reasons why people who have all sorts of interests are watching and looking at what Congress does here, expecting that this may become a new pattern. The first thing to know is that the administration has not spent money it was supposed to all the way through. So that's called impoundment, which we have talked about before too. So already before they asked permission from Congress not to spend money, they just weren't getting the money to the places that it was supposed to go to. And this rescissions bill is essentially formally asking Congress to make it legal to not spend the money that the administration was already not spending. It had a deadline of today. It met the deadline. So this has passed. It's important to know that also publicly, the Office of Management and Budget has been hinting that it will make additional rescissions bills. And it's important to know that there is lots of other federal money that the administration has been withholding or impounding, not getting to the places it's supposed to go. This is all money from 2025 congressional budget that Congress said, yes, we're going to spend money here. And the federal administration has just decided not to send it out where it's supposed to go. The reason why it's important to know that the OMB director is saying there's going to be more rescissions bills coming is that we're almost at the end of the federal fiscal year. And remember that once a bill goes to Congress, they have 45 days to act. Well, if you send the bill 45 days before the end of the fiscal year, you can freeze the spending formally for those things that are under consideration in the rescission bill for 45 days. And that means that if you submit the rescissions bills 45 days before the end of the fiscal year, which is August 15th, essentially all of the money can be frozen, and it doesn't matter what Congress does because you are too close to the end of the fiscal year where the money expires at the end of that year. So that's important to know because we had many, many things, especially in March and April of this year, that normally people would have expected the money to just kind of come to states and to counties and to local communities, and it didn't happen that way. And for a lot of things, that's still the case. The money hasn't necessarily come to where Congress was directing it to go. And now they've held out long enough where they may be able to successfully just not spend the money at all this year. And that puts us in a very different position. So why does any of this matter? It seems like a very nerdy thing to be talking about. The first thing to know is that the rescissions bill that just passed was not bipartisan. It passed with only Republican votes. And it is the first example where one party, after the fact, has taken away money that was agreed to be spent through a bipartisan appropriations process. And that's the reason why so many people are paying attention to this. Because if you are in the minority party, Democrats, and you are working at negotiating what should we spend money on in the 2026 appropriations Congress budget, you've just had the other party kind of upend and throw out an agreement that you made for how to spend money in 2025. So for a lot of Democrats, this particular maneuver is really sending a signal to them that trying to negotiate or coming to some a promise or agreement might not be meaningful if there is will to undo those spending agreements later. And if that becomes a pattern, that means that funding approved in the 2026 federal budget and 2027 federal budgets, if there's a rescissions package like the one that just passed today, that means the majority party could, by a simple majority, simply undo some of the things it said it would fund at any time. That's why people are watching. So throughout this presentation, we're going to give you a couple of very simple questions. If you've lost, if you're wondering what to say to Congress, here's some new things that you can ask. They aren't about Medicaid. We're going to take a week off from Medicaid. Next week, don't worry, we'll have some very bite-sized questions about the reconciliation bill that we think will be useful for you to ask. But these are all very relevant for disability policy. So here's the question. If you're willing to go back on your promise to fund these programs, how are you going to guarantee future promises to fund disability programs? How are you going to make sure that those are honored if this is something that you've done now? Moving to the next thing Congress is doing, the 2026 federal budget. This is usually a long process. We have covered the initial step, which is the president putting out a proposal. The president puts out a budget. It's kind of like a blueprint and ideas. Here's a green light of what things I think I want to fund, a green light of things I think are okay to cut. And then Congress takes over, and there are 12 appropriation bills that cover the full scope of the federal government that both the House and the Senate work on after the president proposes a budget. They take the president's budget and say, okay, here's some things we'll keep, here's some things we'll ignore. We're going to create our own budget. Not dissimilar to what our state legislature does, right? The governor introduces a budget and then the legislature looks at it and makes it edits, right? So the House has actually been working on its appropriation bills. They had a deadline of July 31st to get all of that work done. And yesterday, the largest budget appropriation bill, the one that covers the Department of Health and Human Services and the Department of Education, I think some other things that are important to people with disabilities, they were supposed to have a hearing on that next week, and they have punted that to September. Okay. Well, remember, September 30th is the end of the fiscal year. So you've kind of got to get all of your things done, or you're in a position where you don't have your budget done in time. The Senate has been much slower. They have potentially next week 4 out of the 12 budget bills that they typically do ready to go. But again, not on some of the health and human services things that we would pay attention to in the Department of Education. So this means that if the budget isn't passed by September 30th, the government either shuts down or Congress has to pass a continuing resolution to fund programs while it works out on a final budget. For those of you who remember March, you will remember that we were in the same position in March that it looks like we're on track to do now, where Congress has not made decisions about what to spend money on, and we're going right up to a deadline where we're creating a crisis of either things shut down or um, we have to pass a continuing resolution. Um, we're going to keep monitoring this over the next few weeks of August, and we will have greater detail about what is in these various proposals. I can tell you there are some cuts to housing assistance that we're watching, and th things that we expect will be items that would impact people with disabilities. So Congress is putting together its next budget in the context of a Office of Management and Budget Director who is withholding funds Congress has said to spend and is asking Congress to allow them not to spend things that they have allocated money for. And that really does lead to another question of how are you going to write this budget so that the administration has to spend the money that you're expecting them to spend? Or are you not going to do that and you're going to let the administration freeze, impound, or rescind money that you've budgeted? And of course, we have an interest in disability programs, but you might have an interest in disability and aging programs. This is a pertinent question to ask on anything that receives federal funding. There's also been some telegraphing of additional reconciliation bills. Both the leadership in the House and the Senate have made public comments about doing a second reconciliation bill this fall. And remember, a reconciliation bill is kind of a special process. You can only do certain things that are related to spending in it, but it also means that only a simple majority is needed in the Senate to pass it, which is why it's being used more and more as there's less bipartisan work to get legislation that both parties agree to advanced. You can do one reconciliation bill per fiscal year. So the reconciliation bill that was just signed into law July 4th was for the 2025 federal fiscal year. The 2025 federal fiscal year ends September 30th, and the 2026 fiscal year begins October 1st, which means October 1st, you could do a 2026 reconciliation bill. And some members have said, well, we want to do at least two more, because of course you could do, one October 1st, 2026 starts the 2027 fiscal year. And it's important, some members are talking about they want to rewrite things that were taken out of the first reconciliation bill and figure out how they can get them in some language that will pass the Byrd rule. There are a couple of members, including Senator Johnson, who want to kind of re-elevate Medicaid cut ideas that he had proposed as part of the Senate process that didn't make it in. But also remember, if there is another reconciliation bill, it's also an opportunity for Congress to fix some mistakes, add clarity, or remove cuts that are unpopular. And I think that's the way advocates should look at it. This is another opportunity for us to say, you didn't think these things through, and you made some poor choices, and you have the power to undo those choices. And so here's a question about that. What are you willing to fix? If are you thinking about a second reconciliation bill? Because there's a lot of things that we don't think were good ideas that ended up in the last bill. And a lot of members have been saying, oh, I didn't know that that was in there. Well, here's an opportunity, if you're going to do a second reconciliation bill, to remove the things that you didn't know about and say you didn't like. Okay. So we're going to move from Congress to shift towards the presidential administration. And I have to tell you that since I put this presentation together, there are two more administrative rules that have come to my attention and a couple of other analyses. So we will not have a lack of things to talk about over the summer months, which are supposed to be less busy. The first thing I'm going to talk about is the ACA marketplace. We have been talking about some of the things that were included in the reconciliation bill that will change how the ACA marketplace runs. We've also talked about things that weren't included in the reconciliation bill, specifically the extension of the subsidies that keep premiums low. But there's a third change, and I think folks should understand there's a pattern here. The federal agencies really do set a lot of policy, and they can pass federal administrative rules which have the effect of law. There are I think there are thousands of federal rules because Congress often gives direction, but they may not have the expertise to put down in detail, how should what's the distance between telephone poles, for example? A silly example, but if you're an engineer trying to figure out what exactly do you have to design for, that's an important thing to know. And chances are, whatever federal agency is in charge of thinking about those things probably has some sort of administrative rule that makes sure that everybody who does that kind of work is doing it in the same way. So administrative rules are a really powerful tool that the administration has that dictate to states what they have to do, or can change policies, in very striking ways. The Center for Medicaid Services has a lot of administrative rules. And on June 20th, they passed one that is going to impact ACA marketplace plans beginning August 25th of this year. When you look at the rule, CMS estimates that those changes alone can mean up to 1.8 million people losing marketplace coverage next year. Okay? So the thing that I want folks to kind of know, it's kind of like we're building a cake, like a recipe, right? We have things that are in new legislation, and we have things that are expiring because Congress didn't act, and we have a new administrative rule that are all adding and layering together to create an impact on the same program and the same group of people. So this is additional, right? So what are the changes in the rule? We don't need to go through them specifically, but I want people to know what's changing as of the end of next month. Because some folks, this may be applicable to you. About half of the people in ACA marketplace plans are at 150% of the federal poverty level. And of course, in Wisconsin, because we did not expand Medicaid through the Affordable Care Act, people who are above 100% of the poverty line aren't qualified for Medicaid. They are probably in Affordable Care Act marketplace plans. So we have a group of people that is perhaps larger than other states who are low income and in marketplace. In other states that expanded Medicaid, if they expanded Medicaid all the way up to 138% of the poverty line, they have a lot more people that are covered in their Medicaid programs who aren't in the marketplace. So some of these changes will probably impact people that we know. And there's a pattern here, much like the patterns that we've seen in the prove you're working or exempt requirements, where there's more responsibility being placed on the individual to get things right and file paperwork at the right time. More information that is required for people to produce and to be verified before the next steps can happen, and less flexibility for people to get more time. Also, more flexibility for insurers to be able to change, how they're, whether or not people can stay in a plan or how much those plans cost. So this is what happens in August. The rule also makes changes for the next plan year in 2026. So less than 5 months from now, here's some additional things that go into place. Um, and you'll see there's more changes that are similar to what was in the reconciliation bill, but they're happening earlier. So look at things like auto re-enrollment. Yes, you can have higher premiums. You will have lower premium tax credits potentially. At the same time, the subsidies have decreased. Shorter and open enrollment period. That means you have to have everything done in a tighter time frame. And this is just a reminder of what was in the reconciliation bill. And you can see that some of the changes that are in the administrative rule um, are layered with additional changes that are made by the bill, and that in not only 2026, but 2027 and 2028, there are additional changes that are required by the bill. Um, just this morning, this won't be in this webinar because I read it at 8:45. Um, KFF had a new brief that came out estimating, looking at the preliminary filings from insurers. Insurers are deciding whether or not to offer plans at all in certain markets right now and are calculating rates for next year. And it looks like the predictions are coming true that insurers are planning to raise rates for marketplace plans by the most that they've raised them since 2018. The average is, across the country is a 75% increase, and like you'll see different numbers in the white paper, which we'll share another time. That people should be planning that their premiums are going to increase significantly from what they were. So here's a question to ask for Congress. All of a sudden, people are going to be paying more for maybe less plans that cover less. What are they doing to address the actual cost of healthcare and insurance costs? Because none of what has happened, either in administrative rule or the reconciliation bill, is really helping, lower the driver of the cost that's getting passed on to the consumer. There's also been some activity recently in the Supreme Court. You may remember in March and April, there were lots of federal agencies that wanted to fire and lay off many, many employees. Those employees, their positions and the funding for those positions had been approved by Congress. And, DOGE, which was the name at the time, DOGE still exists, but they aren't calling it this. It's still underground and doing work, but it's not called the same thing. Um, they decided that all of those people could go. And a lot of states sued for a variety of reasons, but mainly because, hey, all of these people who are being fired do things and manage programs and are experts that states rely on to get money to states. And on July 8th, the court allowed the administration to do the layoffs without consulting Congress, even though they said they're not ruling on whether it's legal or not to do that. In practice, that ruling is a green light that the administration can go ahead and eliminate positions and functions regardless of whether or not the court decides later if it was legal. And on July 14th, this week, Monday, DHHS formally laid off about 10,000 employees that it had wanted to lay off in April, including folks that work for the Administration for Community Living. The Department of Education has let go a number of employees, and a Social Security Administration also had a many thousands of employees that it was planning to remove. The Department of Education has also been busy in and of itself. On June 30th, it stopped $6.8 billion of 2025 funding that was approved by Congress from going to states. That was a $72 million hit for Wisconsin. And it was for a variety of programs. The Department of Instruction has a kind of federal funding impact website. So if you want to look up what are all the programs that are impacted by this specific holding from the Department of Ed, you can look that up. There have been other federal funding impacts as well over the last several months. And states are suing about this because again, this was money that Congress approved that the agency is deciding it is not going to spend and not going to send to states. And this money often goes to school districts as part of the budget they're counting on for operating next year. So here's a question for Congress. What are you going to do about that? Are you going to allow a federal department to just withhold money from Wisconsin and the school districts who are expecting it? The Department of Education, we've talked a couple of times about this, has really made a tremendous number of staffing cuts in its Office of Civil Rights. It pretty much reduced the number of people by staff by 50%, and a lot of the cases that the Office of Civil Rights handles were disability specific, about 50%. They also reoriented what kinds of cases they were going to take away from disability to other things. And now there's some actual evidence about what that means. In 3 months, the agency received almost 5,000 complaints and dismissed almost 75% of them. There were only 309 investigations that were open. So that really tells us that if there's a school district who really isn't doing their job to help to follow the IDEA, it is going to be extremely hard if that is not mitigated within the state to have the federal agency look at that and take action. And they have, that is a big change from previous administrations and the years. So here's a question that you can ask about that. Maybe some of you have had challenges with districts in the past or have had to use the Office of Civil Rights at the federal level. What does it mean when your last stop is unlikely to do your case for folks' education? And Social Security continues to be in the news. First of all, there were a number of folks who got a misleading message from the official Social Security agency that claimed that federal income taxes on Social Security benefits were eliminated in the reconciliation bill. That provision wasn't in the bill. That is not true. There are some things that were included in the bill, and you can see in that third bullet what was included in the bill, but there is no provision in the bill that directly eliminates or even reduces taxes on Social Security benefits. So that's something to have in your mind as you don't want to be expecting that you'll have to pay less taxes and then be surprised that that isn't the case. Social Security has also stopped reporting various metrics that we think are important to show the performance of the agency. So this is really important for people with disabilities because so many of us rely on those payments and either on SSI or SSDI, or people who have acquired disabilities or significant illnesses are waiting on Social Security to get a disability determinants. So not having the ability to to really see whether or not the needs that people have that are really important are getting taken care of in a timely manner is alarming. And especially the idea that the processing times for retirement, survivor, disability, and Medicare benefits and the time to reconsider disability decisions, that's gone off their website. And for people with disabilities and older adults, those are some of the most consequential things that Social Security does. We already know it takes a couple years to get your first disability determinants, and lots of county folks will say you almost always get denied the first time, you have to appeal, and the wait for that piece can be between 2 and 4 years. And that's really necessary for a lot of folks who are applying for Medicaid to have that in place. So, a lack of performance in those key areas really does, significantly make a problem for people, and can leave them in kind of a healthcare limbo and be really difficult to navigate. The other thing that is being reported is a lot of the staff with expertise is being shifted to, especially to make those decisions that are really important to people with disabilities, those cases that really need somebody with expertise. Those staff are being shifted to lesser duties in some ways, answering the frontline phone. And that means there are a lot fewer people who are handling the complex stuff, which could increase the wait times and how those cases are handled, to be much longer. There are thousands of people who have already taken early retirement. The Social Security Administration claims it wants to shed more positions. And right now, we have the fewest number of staff in relation to the number of beneficiaries that we've had since 1967. So here's a question that you can ask your members of Congress. And I know lots of you have had experience with Social Security and have, found them, very helpful in the past or have had to wait a long time. This is a question you can ask Congress now. What are we doing to make sure that you have people in the positions that need to do the detailed work that requires expertise? How do we have the right capability of staff to resolve things faster, especially for this population? Couple of administrative rules. I think that we should expect that there will be a flood of administrative rule changes. I just referenced these two came out today. There was a couple that I've seen even this morning. This one is rolling back a provision that allows home health workers to have overtime and minimum wage protections. The rule wants to repeal a rule that's been in place for more than 12 years and return to the way things were in 1975. We can public comment on that. And here's a question that you can ask for Congress. Congress often is not aware of some of the administrative rules that are being proposed or what they mean. So sometimes asking these questions is really an important thing because they may not hear about it any other way than a constituent. Another administrative rule, this one is applicable to many agencies and programs, and it is a change for what programs legal immigrants can be qualified or not qualified to receive. So this is a big change. There are lots of the long list of programs that are covered by these various agencies that now are reclassified as a federal public benefit, and they are now saying, even if you are an immigrant here legally, you are not able to use any of those things. Again, another question, maybe you have others that you could ask about that particular policy. So coming very soon, we've started a process here where we have questions that we hope are bite-sized and easy to ask so that you can, keep having something to say to your members of Congress, Senate, and your congressional representatives. We're doing the same thing for many of the issues we've been talking about for months in the reconciliation bill. Short, bite-sized questions that give you something to ask and keep the pressure on. Our own Caitlin is working on the social media memes right now. So we're putting together a social media calendar. If you are an organization or have pages that you frequent, and you can share out these questions with other folks with a request to make your calls. We're also developing a survey in the moment. And so, this week and next week, you can ask the questions that were in this presentation, but know that there are more questions and more support coming for you to be able to, keep engaging with Congress and keep reminding them that people are paying attention and asking very reasonable things about what they've just passed in the reconciliation bill. Next week, there is a Medicaid vigil that some national groups are holding. So if you are looking or interested in submitting your story for that, you certainly can. It's a national event. I don't know if any of you are planning to travel to Washington, D.C., but if you are, you can be there in person. And we have our very own Wisconsinite who is riding down to Madison from, I believe, Nina. He is open to people riding with him. So if you follow Carl on his social media and he is in your area, I think he welcomes people to kind of walk with him on his journey. He's concerned about not only for paid caregivers and the need to address the caregiver crisis, but what Medicaid cuts might mean for an already existing crisis of a lack of people to help provide care. So I think it's a really he's getting a lot of attention and already some stories. I think he's holding a press conference today in Ripon, and if he is in your area, let him know. Contact him on his socials, and maybe you can ride along with Carl. The last thing, we're changing our schedule a little bit. Next week, we will not hold a webinar, but then we're going to be back. In August, I'm going to be doing a little different format. So for the 4 weeks of August, I'll have kind of an office hours. So this time, 9 to 10 o'clock on a Friday, and I'll do just like 15 or 20 minutes of the latest things that have been happening. And then we'll open it up for a discussion. We may have some questions for you. There are some things we're developing. I've referenced a survey a couple of times. We may want, we have some folks who are in congressional districts, people like yourselves who are trying to plan events and think about how to do stuff. They may want your feedback on that, or maybe you're interested in helping them plan this stuff. We're not going to record those sessions, but we will send out the slides to everybody that registers. So for those 4 weeks of August, that's what we're going to do. And in September, I think we'll be back to weekly webinars, because at that point, we can expect a lot more action as the 2026 budget process heats up and Congress decides whether it's doing a reconciliation bill, and we're going to start to see some of the first impacts on the ACA marketplace plans and SNAP become clear. Okay. Are there any questions, Sally, or have you gotten everything answered?
We've got everything. There was one question. There was somebody who had been on a national policy discussion where they were talking about the 2 times a year eligibility and saying that it would only be for expansion. And I answered that saying, we don't have all those details yet, but I thought I'd let you say if you had any specific information.
Yes, you've picked up on a really weird thing. The fact is, Wisconsin doesn't know how that applies to us quite yet. We are not a state that applied to ACA for expansion through the Affordable Care Act. And lots of national people will talk about the ACA expansion in the context of the 40 states that did that and forget about how unique Wisconsin is. Because technically, we did expand coverage to that population of people, but we did it through a waiver. We did it through an 1115 waiver in Badger Care, and we cover some of the same people who are expansion population, childless adults, but we only cover them under up to 100% of the poverty level and in the waiver. And the law did say if you have expanded Medicaid under a state plan, a waiver of a state plan, that's Wisconsin, or under the Affordable Care Act on some provisions. So we have a question about the Medicaid eligibility piece and whether that applies to Wisconsin and how many people. I think that, obviously our state would like as few things to apply to us as possible. So if there is an ability to challenge how that provision was written and say that doesn't apply, I think Wisconsin apply. We think it would only apply to the childless adults in Badger Care because that is the population of people in the waiver that we expanded to beyond, the mandatory populations that have to be covered under the federal law, federal Medicaid law. It's clear as mud.
Thanks. I think that answers that.